Good afternoon. As we typically do, we'll give you a case update. Currently, we have a total of 209 cases. I want to also remind the population that 14% of tests to date are positive in our community. So we have had an increase in positivity rate, we call that. So as more tests are being done, more of them are coming back positive. We also have an additional 2 deaths that have been identified through the coroner's office, bringing our total death count to 11. But I also want to talk about the social distancing, which is having an impact. Our initial projections, if we were to go back 2 weeks ago, we talked about cases doubling every 5 days. Currently, they're doubling every 8 days. But we can't let the guard down now because approximately 15% of the cases in our county are hospitalized. We continue to have locations of concerns. As we learned over the weekend, the state of Illinois is now posting our long-term care facilities and the number of cases that are confirmed in both staff and or residents and the number of deaths for those facilities. And I want to remind everybody that does not include all of our congregate settings. In our daily report, we work with our congregate settings to self-identify so that you can have a complete count, really, an understanding of what is going on in our residential type communities. So as we go through this, one of the things that continues is the spread of COVID among employers who have been deemed essential. So when we talk about staying home works, right now we're starting to see cases in what we call our essential worker population. So public transportation, we learned over the weekend about Rockford Mass Transit District and the number of cases reported there so that, again, they have to alter their routes. We've learned about our grocery stores. Several of them have come forward to identify that they have had cases. Some of our food processors in the region, manufacturers. So while we talk about when can we come back out, we have to also identify that our essential workforce has been identified with cases. And we work with those employers to both inform employees and customers, depending on the location. And one of the things that we do, we talk about code enforcement. We always hear about the bad side of code enforcement when we're going out on the essential services, is really to work with those essential services to make sure that they're able to adhere to the community mitigation standards. Even if you're an essential employer, you're supposed to be maintaining social distancing of 6 feet, which means sometimes you have to alter how you manufacture, how you place individuals. What do your lunch breaks look like? What does your lunchroom work? What does your locker room look like, depending upon your facility and what you do? Hand washing, we cannot stress this enough. I got a call today about someone was cited for not having paper towels, and I said, well, that's critical right now. If your employees cannot appropriately wash their hands, that is a problem for us. Masking, you heard Chairman Haney talk about this. We're talking about the masking of essential workers. And again, that importance of that, because again, we're trying to protect our essential workforce that are providing child care. They may be your grocery store. They may be your pharmacist. They may be your healthcare workers. And all of those individuals, essential workers, need to be taking on the appropriate masking. Cleaning and sanitation of surfaces frequently. So when we identify a case in an employer, we begin to take a look at how frequently are those surfaces being cleaned, frequent touch surfaces. Sometimes we'll talk about how can you not have a touch surface. So if you're used to people clocking in, figuring out how can they not clock in so they're not hand touching something, keeping doors open as people go through, and at the same time protecting the safety and security of all of this. These are all things that have to be done really dependent on the workplace and the work site. In addition to employee monitoring, you've heard about temperature taking, symptom checklists, and again, encouraging workers not to report when they are sick. And I think many of our employers have really taken this to heart. And as we go through this, they continue to have outbreaks and cases within their workforce, which is impacting the ability to deliver essential services. We talk a lot about contact investigation and tracing. The new term you hear about contact tracing, we called it contact investigation before that, a little bit longer word, but every time we identify a case, we find out what that person does not do, who they interact with on a daily basis, how much time do they spend in contact with that individual, as well as their household, where they travel, where they go. We heard about a little bit about national intention about using some of our cell phone data, but right now we use just basic personal interviewing and finding out who did you have lunch with this week, and some of those things that are very difficult, and all of a sudden someone says, oh yeah, I sat next to so-and-so. I didn't intend to. I wasn't even thinking about it. And so we're all having to change how we view what we do in our daily process. Who do we sit with? How far apart do we sit? As we've gone through, we now sit as far apart as we can. We mask coming in, we mask walking in our halls. As you came in today, you were temped if you're one of the reporters, or you're masking up as well. Because this becomes part of that way that we can stop that community transmission. Because masking is essential to protecting our essential workforce. So when we talk about, can we lift restrictions? I've gotten a lot of questions about when is it time? So even if you look at the national programming and all of that, we're talking about, what are we talking about? One incubation period, or at least 2 weeks, where there's no sustained increased number of cases? We're not there yet, folks, right? You've seen, we've got more cases, and we've got more death. So we need to understand what this infection looks like before we can kind of just roll out in general. We understand that there are equity concerns and issues regarding small businesses versus big box stores. And again, I come back to, what can we do as the public? Well, wear a mask to protect others. So not only do you protect yourself, protecting others. Stay put, stay home. We've talked about this, only traveling out for essential services such as food, medicine, or gas. Minimizing contact with essential workers. Wherever you can you do curbside pickup? I've just told you about some of the essential workers that are being impacted. Is there any way that you can either call in your phone orders, do it online? There's all kinds of different pickup, and really then curbside pickup. Why? You're protecting that essential workforce that we need every day to really help us deliver the groceries, to make sure that we have the medicines, to make sure that we have essential services that we have available to us. And I remind everyone that healthcare is an essential service. So your healthcare providers continually want to remind you, do not let your chronic diseases go unmanaged during this pandemic. It is important to get your medications refilled. If you're having an issue or concern, you can do a telehealth visit. If they determine that you need to be seen, they will bring you into the offices. But this becomes very important. Do not let your health decline during all of this. And we talk about that staying calm, stay connected. Everyone's got a little bit of anxiousness and anxiety as we continue through this. It's hard to stay at home. We've heard about the schools. We know that that's a very difficult thing for our parents to be the teaching at home and at the same time trying to keep people calm, keep it together. All of a sudden you're teaching, you're the daycare, you're the house worker, you got it all happening in your household. Again, using our local resources like 211, which is, we fund that through the Rock River Valley Region United Way, which is a local resource and can help connect you. We also, are identifying the call for calm, which is the state of Illinois has the text talk, TALK, to 552020. Again, you can text the word talk to 552020. And again, becomes for our Spanish-speaking population, there is information on the website on how to access it in Spanish language as well. But it becomes important. I know everyone is itching to get out, but right now the work that you're doing is keeping our infection rate lower and our hospitalization rate. For those of you who remember, when I came back and said if we projected 20% required hospitalization, we would have sufficient. And by keeping it at 15%, that's awesome. So we need to continue to do our part. We can't let our guard down now. And especially as we ramp up more testing, we expect to see more positive cases. But we can all do our part. And I know this is a very difficult time, but these are the basics we have. Until we have a medicine, until we have a vaccination, we all need to do our part and stay put, stay home as much as possible to protect not only our healthcare resources, but our essential businesses as well. These are the assets we have at the end. We cannot restore people. We may be able to restore some businesses. We may be able to restore it in different ways, restore how we've been doing it, but we can't restore lives lost. So again, I thank all of our population for working on this. I know that the weather's getting nice. Try and be able to social distance. Take a walk in your neighborhood. Take your dog out if you've got one. I'm sure these dogs are the healthiest dogs we've ever had during all of this. Making sure, I've heard bicycles now, and people are using bicycles for more active transportation around. Again, but maintaining that 6 feet of social distancing. This is what we can do to protect not only our population, but all of our vital and essential workers, essential businesses, and our healthcare. So thank you.